Ma'am, also another thing is women have this tendency to want to be thin as possible, as slim as possible. So I've seen women starve themselves. People whose body structure do not allow them to be thin, I see them starving themselves. Does it affect fertility?
So too much or too less of anything will affect your normal physiology. So when we talk about being too thin, so if you are too thin, you would have multiple issues even during pregnancy or planning pregnancy. So all these diets which are shown on social media, for drastic weight loss are very harmful in the long term. When you plan to lose weight, so it has to be done in a structured way. So it is done according to your body shape, according to your family history. They'll take your history, they'll do all your blood test investigations, your liver test, your renal test, then give you a diet which will tell you on how much maximum you can lose and what's your ideal weight according to your body structure. So that's how weight loss should be done, and that's only should be done after consulting a good dietitian. I would not say just following any diet on Google. Take some time and talk to a good dietitian and they'll guide you, because if you go lose weight too fast, your bones will get weaken up, your hormones will go haywire, and multiple issues will happen. So then that's also becomes another problem. Oh, I've lost weight, but I can still not get pregnant.
Ma'am, also another thing is women have this tendency to want to be thin as possible, as slim as possible. So I've seen women starve themselves. So in a world where we're all looking for quick fixes and shortcuts, we are talking about being systematic in our approach.
There are no shortcuts for anything. You have to work hard to achieve something.
That's true. That's true. So in a world where this is a question out of personal curiosity, does past ectopic pregnancy affect future fertility?
So, it can affect future fertility. First of all, we'll have to understand why ectopic happened. There is no way you can prevent ectopic. Ectopic is quite prevalent in Indian population because of history of tuberculosis, which is undiagnosed in most part of our countries. So, and that's why if there is a history of ectopic in your body, there's also a chance that you'll get ectopic again. Secondly, if you've got ectopic now, and if they've removed that tube, so you've lost one tube, and so that's also an added factor of decreasing your fertility for the next cycle. So there are multiple ways where ectopic can actually hamper your fertility. So it can be because of your damaged fallopian tube, or there can be recurrent ectopic because of history of tuberculosis or pelvic inflammatory diseases. So you have to understand that once you get an ectopic pregnancy, a scarred fallopian tube will actually make it harder to conceive. And it will also put you on a higher risk of another ectopic.
And this is a question out of personal curiosity. Does past ectopic pregnancy affect future fertility? Does it cause miscarriages also?
Not really, but previous ectopic doesn't cause miscarriages, but pelvic inflammatory diseases, which were a reason for ectopic, can also be a reason for multiple abortions.
So it's all tight and interlinked.
Yes. That's why it's becomes so difficult, when a patient does not follow up with one gynecologist regularly. So I have come to you, I've had an ectopic, but because I had an ectopic with you, I am now upset with you. I change my doctor. Then I have an abortion. I get upset with the second doctor. I change my doctor. So when you keep changing doctors, the history also goes, haywire. And then the doctor can't correlate. Oh, that happened last time. It can be that. So sticking to one good doctor will actually help you conceive better or faster in your journey.
I think that's very important, because even me, I didn't know that medical history will guide you towards your fertility solutions also. And I think a lot of people, majority of the people in India do not do that, or are not even aware they should be doing that. That's great.
Agree.
Yes, we've talked enough about women. Now, does medication, heavy medication, affect male partner?
So, males have it easy most of the time. Their sperms can regenerate, a lot of medications which are there can improve your sperm count. So most of the times it's not very difficult. The males do not have that biological clock also around them. And most of the medications which men take for anything usually don't affect the sperm count. Very rarely any drug can be transported into the seminal plasma or something, but no amount of drugs in men are actually, have data to prove that can cause fetal damage or can decrease your sperm count. So it's actually very, very good point for us that if men are on some drugs, but drugs like if we talk about cocaine, marijuana, and even those drugs which are used in the gym to build bodies like steroids, high level steroids, those are the ones which actually negatively impact, the fertility, and they actually affect the hypothalamic pituitary axis, and then the sperm function drastically will decrease. So these are actually harmful drugs and they are not given regularly to men. But if men are on long alcoholic intake, at least every day, twice a week is something which we say is okay. But if it is more than that, and if they are smoking 4 to 5 cigarettes per day, or if they're on drugs like cocaine, or then these are problematic issues which can impact their fertility.
But these are treatable and temporary issues, I believe.
Yes, if they stop those things, they're very temporary. So that's what I'm telling you. They get it easy in every way.
It seems a little unfair.
Yes.
Again. So then you also said that they don't have a biological clock. So the age of the male partner do not affect fertility?
No, so that is 50 years of age. Usually there is no issue in men conceiving. And that's why you see if men have multiple marriages, even at later stage, they can easily conceive with a younger woman.
Yeah.
And that's how, so sperm function and quality actually decreases only after the age of 50. So that's why their biological clock is quite, long.
Yeah, and even then, if you have got enough count, then you should be able to get someone.
Yes.
The terminologies for fertility are changing. You've got infertility, and then now I hear subfertility, and things seem to be changing. And attempts are being made to destigmatize fertility, the infertility. What kind of treatment options do we have now? Are they also changing?
So we have a lot of treatment options. There's a huge basket of options which are available to us depending on what the patient actually needs. So when we talk about infertility and subfertility, these are very interchangeable terminologies, So when we say infertility is inability to conceive, subfertility is possibility of conceiving, but taking a longer time, just to put it simply.
Makes sense.
So when we talk about treatment options, there can be treatment options for the men, there can be treatment options for the female, and then there can be multiple options which are combined. So like if there are tubal blocks, we have now latest technologies with laser which can open your tube. So, so laparoscopic surgeries can be done for your tubes. Laparoscopic surgeries are easily available all over the country for endometriosis, for fibroid surgeries. You need not go through that major surgery of removing fibroids. It can be easily done through pinhole by a laparoscope. Plus, if you have subfertility, you need not go directly to ART procedures, just a basic counseling with proper medication, lifestyle guidance, and maybe a little push in the direction with some ovulation induction can give you pregnancy. Then if you really have very poor sperm counts, then maybe you can go through ART procedures with ICSI. Very, very poor sperm count, even on a slide, if you see 1 or 2 motile sperms, pregnancy can still be achieved with the same person. So we have really come on a very advanced way of giving pregnancy to couples who have lost hope. We have embryoscope available with us, which tells us which embryo has, the best chance of giving a live birth pregnancy. So for patients who have recurrent abortions, where we don't understand the cause, we use such technologies. Then, if you've heard of, people are very scared of having infertility treatment because of mixing, they come and tell us that, is this my child or not? So for that also, we have an RI witness system in most of the labs in India, which will guide us in preventing any mixing happening in your lab at every interval. So it's really become very, very advanced in technology, but the part where patients are aware, that's very poor. So
Yes.
patients still don't know how well equipped an ART center is now to help them.
Is stability an issue for many patients?
It's still quite, cheaper than other countries, I would say. Yes, we don't have a very good insurance system right now in India, but it is on the verge of coming under insurance. And once it does that, it'll be like a big boon for people who can't afford it.
Yeah.
But even right now, if patients are aware and if they come to you at an early stage, then they can easily afford a good infertility treatment. Sometimes they get so scared of the expenses, they wait a lot of time and waste, and they come in their late 40s, and that's when the treatment becomes expensive, because now you've crossed that biological clock. You've have very limited number of eggs, and then you need becomes difficult. So my point would be here, as soon as you have difficulties in getting pregnant, you come immediately to the doctor, and that's going to help you.
Right. What do you think of a sperm washing machine? Do you use it? How effective is it?
So I'll tell you, my brother is an embryologist, trained from Monash University. So everything in my lab is done by him, by hand, and he actually likes doing everything by himself. Even with semen analysis reports which come from outside, we always like to do it again to have a check. And so that process is given all to him, and he feels that the first point to tell whether the sperm sample was good or not, and what kind of treatment this patient requires, an embryologist should always be taken into picture, because they'll be the person who will actually guide you in whether these sperms are really good for fertilization or not. So, sperm washing is also a little bit of marketing thing which is happening around. But it used to have an advantage of saying that it removes all the chemicals, the dead sperms, and the low motility sperms around, and gives you a better quality of sperm concentrate which can be used. So yes, it will help.
Have you ever had to, recommend a home insemination kit to your clients?
So I don't know if you read the news a few days back. There was one case which was done where now they had twins, and the twins have maternal DNA but do not have paternal DNA. And a huge case was done on the doctor. The doctor tells us that when the patient came to them, he got sperms in a container from home. So it's a very difficult thing when you give your patient container to go home and get it, because it can be from anyone else also. And that is something which the problem relies only on you, because you cannot tell on that time that this container was husband's or not, because you don't do any genetic test on those. So in our center, we do not give any home collection. We don't allow them to, we have a very nice, well-equipped sperm collection room, which is very, very private, but we don't allow them to, go and get it from outside.
In case of legal actions in the future.
And there are multiple legal actions happening here. So it's we have to be very strict for those.
Yeah, that's a very, very good point. Well, thank you so much, ma'am. This has been wonderful. It's like two old friends meeting and talking over a cup of tea. Thank you for agreeing to do this with us, and also for the future dates that we have.
Yes,
from Subhag Health Tech, we wish you the very best, and God bless you, and have a very happy Sunday evening.
Thank you so much. Thank you, and same to you.
All right. Bye-bye.
Great. Bye.
And from Subhag Health